Thanks, Jamie, for the introduction, and thank you to everyone who's on this call. I think fair to say that there's so many wonderful companies and people out there doing amazing things and pushing the boundaries, and so we are very fortunate and lucky to be here with everyone else here. So a brief introduction about me and kind of what we do at Apian. So I'm a doctor in training at Barts and one of the NHS Clinical Entrepreneur programs, which was founded by Professor Tony Young. And this program is the world's largest healthcare workforce development program for clinicians. And really the aim is to bring innovation back into the NHS, and rather than trying to get other people from around the world to try and push their technologies in, we, as a British kind of nationalised health system, we push it out from within. And so really Apian is founded as part of the NHS Clinical Entrepreneur Programme, and the aim is really to create an interface between the drone and the medical industry. One of the key things that we strive in is to create a faster, better and cleaner healthcare. And so recently we have had the opportunity in starting our trials and to begin working with the Mid South Essex NHS Foundation Trust, which is near Cambridge and in Essex. And it's actually a very interesting opportunity because just back in April, the three trusts actually merged from Broomfield Hospital with Southend Hospital and Bowsend Hospital. Those be merged together, and they separated by kind of some A roads and about 20 or 30 kilometers of distance. And really there was the opportunity in trying to consolidate these services and to prevent the duplication of land, labour and cost. And so really then the opportunity came about when we from being on the front line, hearing the fact that pathology samples are not able to be transported in a reliable fashion. And the key really is to have a service whereby couriers are able to deliver in a more regularly and reliably, but also sustainably as well. And so the trial really began from South Essex to try and bridge those services together. And this really kind of has, COVID has really accelerated all the work that we've done before. Really, from before this, the Mid South Essex actually approved the business case to use it, and for other use cases, these included things like search equipment, where if a surgeon drops a piece of equipment on the floor and it's sterile, then the question is, do you either autoclave it or do you go down the road of actually getting the new surgical equipment from somewhere else? So really what we are doing right now is between Broomfield and Pathology First, which is based in Basildon, we are trying to go an incremental step in trying to create a service whereby as a clinician interface, they can order and deliver these kind of pathology specimens through our interface. And we have recently partnered with Unipart. Of course, they are the incumbent logistical supplier of NHS supply chain, and the ones who are supplying all the clinicians with the PPE kits on the front line in protecting them and the patients, which is a great relationship with them. And Versapack, of course, they are I'm sure many people have seen those bags being used in London's ambulances and in pathology specimens in carrying the pathology specimens in a unified and standardized way. Next slide, please. So on the screen here, you can see the drones that we're using, and it's branded with the NHS colours and as a tribute to them, and our way of showing our gratitude to all of the hardworking clinicians on the front line right now. And so really what we do is to create an API. So this is a digital API and a physical API. And the digital API really is all about how do we ensure that there's a smooth workflow from a clinician's point of view in ordering these bloods, and essentially tracking where the bloods are going, what the results are, and when they can expect the results to be published back to them, so that they can either then triage the patient or they can discharge them in a timely fashion. And really it's about creating the standards and best practice guidelines. What is the way in which a clinician should approach the service according to their local guidelines, but also national guidelines as well. And really a lot of what we're doing is evidence-based, and so collecting these data and ensuring that how do we work out the time to diagnosis, how we improve that, and ultimately improving patient health outcomes. And that is always the key and the core value of what we do. And the procurement of items, and where we like to think of it as a grid of between the different facilities, and making sure that if there is a spike in COVID cases, then we can immediately address those cases, and trying to forecast those spikes as well. And then the drone container and the air grid is really talking about a national air grid, or whereby you, from one end of the country, you can have a need of a piece of equipment or a COVID swab sample, and there is a big spike, and the pathology lab isn't able to accommodate for that. Then how do we get from one end of the country to the other end through this air grid? And so really what the whole solution is based on is to create that standard. What is the how do we encourage people to adopt these services? It's all well and good to try and use drones and the coolest and latest tech, but how do we win hearts and minds right across the whole sector? So that's what we believe in. So thank you very much for your time, and any questions, more than happy to answer it.